It was a powerful day that began at the Mississippi State Capitol and continued with a luncheon where we further uplifted the policies that would improve the quality of life for Mississippi families. From advocates and community leaders to partners, legislators, and students, we stood together in the spirit of our theme: healthy mothers, strong families, a prosperous Mississippi. The white ensembles worn symbolized both the legacy of women who led movements for change and our shared commitment to progress. That unified message made clear that Mississippi's future grows brighter when voices are heard and valued. Our legislative agenda reflects that vision. We champion policies that support mothers and families and those that will move our state toward prosperity, including family and paid medical leave, maternal health access, Medicaid expansion, accessible child care, voting right protections, and living wages. Today was not the end of our advocacy, but a continuation of a movement that will continue beyond the walls of the Capitol and out into community.
Again, thank you to my colleagues who are here with me, and just the Black Women's Roundtable. Y'all some bad girls. Some soul sisters doing some bad things, and I appreciate that. And I just like to say that I have to say this. During our past election cycle, the program that you all had, sister to sister, in these small communities, it was just a joy. And every single time that I called and asked Sister Welchland, said, can you all come to little places like Rolling Fork, or can you come to Cary? It was without hesitation. What do you need? We have a profound responsibility before us. We can choose policies that perpetuate disparities, or we can embrace a bold, progressive, community-centered agenda that uplifts families and strengthens Mississippi as a whole. But I will say this: from justice to equity and opportunity, these are not at all partisan ideas, but these are truly Mississippi values.
I'm also grateful to the Mississippi Black Women's Roundtable for hosting this Advocacy Day and for consistently standing in the gap for women, families, and communities across our state. My son, who has hypoplastic left heart syndrome, first of all, I found out when I was 4 months pregnant through a ultrasound that he has hypoplastic left heart syndrome. What that is everything to the left did not fully develop. So meaning everything to the right does all the work. So he has to go through several different surgeries. I've been at his bedside for 8 months, so I was not able to work due to me having to be at his bedside. Saying that to say, because I had access to Medicaid, we were also put in contact with different organizations and people that could come together and assist us during, that time frame. Of course, we didn't have any idea that it would be 8 months that he would be in a hospital.
You're standing with an amazing movement here. We are a movement. And so we just want to say that to you, that we stand with you. And we will continue. These legislators that are here with us today, they're fighting on the inside to make sure that these policies that we're introducing get done. It may not happen this year. As somebody said, it may take 10 years, 15, but okay. But we also are the women that are also running for office and gonna take these seats. And so we just want to say thank you for sharing your story.
I also want to really talk about 4 bills that are still alive for the diaper banks. Eliminating the tax on diapers, House Bill 491, House Bill 281, and House Bill 797, and Senate Bill 2872. I've been working around with diapers for a long time, and I will tell you, that's one of the most requested things. If you work with families, everybody's asking for diapers because diapers are expensive. And then again in 2022, all paper goods increased. Have y'all noticed the paper towels that went up? Tissue that went up? So not only did diapers go up, but also menstrual products. All these products went up, and and guess what didn't go up? Minimum wage. Our paychecks didn't go up, but the price of everything else went up. Diapers, menstrual products, and other basic essentials like soap and other things should not be taxed, because those are basic things that we all need as a human. So I ask you to support these bills and to talk to your legislators and encourage them, because this is a workforce issue. This is a community issue. This is a human issue.
We are hopeful that this year that our bill will make it all the way through the House and through the Senate as well. This bill differs a bit from last year in that now the Department of Health will be sort of the umbrella for the midwifery licensure. I think that's very important because right now it's a self-pay, it's a cash pay system. And many of our midwives perform their services for very low reimbursement. So if we could have this step to have midwives to be certified and have licensure, then we can require Medicaid and health insurance for reimbursement for these services.
Now is the time for us to continue to remain engaged, to educate our communities, share the data that's out there, and most importantly, share the lived experiences, meaning telling your story. Meet with lawmakers like you've done today, and build broad coalitions like you are a member of today that demonstrate both the human and economic impact of paid leave.
Thank you for standing with us and for believing in a Mississippi where equity, justice, and opportunity are shared realities.
To help support the work MSBWR is doing in the community, log on to msbwr.org to make a donation.